I see a lot of baseball injuries, and most of them are overuse from biomechanical issues that they've had for a period of time. One thing that we have, the glenohumeral internal rotation deficit, tight shoulder capsule, where we're building for a faster throw or pitch, gaining external rotation. The athletes, they'll lose internal rotation, then you lose the force. The force stops and the shoulder takes a lot of pressure and force, leading to injuries. Taking rest days now will allow you to be able to continue to participate in sports for so much longer than if you push yourself and burn out. Like some of the athletes that we see in the professional level, they have such short careers. It's the same reason why Ronaldo, Messi, as they're aging, they have been playing professional sports at such a high level for so long. If you don't have core strength and pelvic and hip and low back stability, or you're doing too much overuse, not having appropriate rest days, you will get issues in the posterior chain. It's one of the weakest parts of the body. Most people are heavily quad dominant. Pretty much everybody really is quad dominant, but it's just about the ratio. So I think for hamstring to quad ratio 3-2 is the best.
Welcome to Fightful Nutritionist Podcast. Today, I sit down with Dr. Toor to talk about sports medicine. Dr. Jasmine Toor is a board-certified physician specializing in primary care, sport medicine, and internal medicine, with a strong focus on optimizing athlete health, recovery, and performance. She serves as the Director of Sports Concussions at Mercy Sport Medicine in Baltimore, where she leads concussion management protocols, coordinates multidisciplinary care, and works closely with athletes, physicians, and high-level sports programs. Her clinical work spans both concussion care and treatment of musculoskeletal injuries, within a clear emphasis on safe return to play and long-term performance sustainability. Dr. Toor completed her residency in internal medicine at MedStar Hospital in Baltimore, followed by a fellowship in primary care sport medicine at the Children's Hospital of Philadelphia. She has been recognized as a top doctor by Baltimore Magazine in 2024 and 2025. Her work is driven by a commitment to advancing athlete care beyond injury management, with a focus on education, prevention, and long-term health, helping athletes not only return to play, but extend and protect their careers. Why did you decide to become a doctor first, and why sports medicine?
I've wanted to become a doctor for a long time, since I can remember. Always been fascinated with how the body works, and recovery and injury really motivated me to look at the curiosity of medicine. A lot of people will say we go into the field to help people, which definitely, of course, but I think it's just coupled with my love of science, how the body works, and it's just the way things come together and work together is so amazing. The way that it can go right, the way that it can go wrong, and how you can figure out what's going on to help people feel better and a return to things that they love doing, like their daily activities. I actually took a less typical way into sports medicine. I was internal medicine physician for a number of years. I did that for 4 years after residency. I'm from Canada. I've worked in the US since about 2014. That's when I did my residency. And after I finished my residency, I did primary care and hospital medicine. I've always grown up playing sports. I still play sports. I still play soccer right now. Every Wednesday, I'm very active. When I would see patients is around prevention of disease, chronic conditions, illnesses, and it comes down to a lot of fundamentals of exercise, health, diet, those type of things. When I would see my patients with high blood pressure and diabetes, or active people when they have injuries, I really felt strongly about learning more and going into a field that can help prevent them or treat their conditions without specifically medications. Of course, medications are very important, but the lifestyle way of treating conditions is really important. After a few years, I did a sports medicine fellowship at Children's Hospital in Philadelphia and Jefferson Health. I did changed career pathways into something that I was very passionate about. It was very difficult to do, to go from something where you're very comfortable, you have your job and your own schedule, and you go back to training. It was the hardest and best thing I ever did, because every day I go to work excited and I really love what I do. That's how I ended up being in sports medicine, meshing my favorite passions and the things that I enjoy about medicine and the human body, and putting it all together to help patients and athletes progress and return back to activities.
What a sport medicine doctor exactly does?
Sports medicine is a pretty wide career field. Jobs can look very different depending on the type of things that we're interested in doing. Some sports medicine doctors really focus on working with a team, and athletes in the US, usually we have jobs with hospital systems that are contracted out for with teams. I work in an orthopedic practice where I work in an outpatient setting. I do sports coverage for different events like marathons, races, 10Ks. There's a big race in the US, horse racing. There's the three Triple Crown. The Preakness is in Baltimore every year. We do medical coverage for those type of events. We can also work on sidelines for high school football, college games, and a wide variety. It's really anything that we're interested in, we can really find an avenue to go towards that. Day to day, I have office 5 days a week. I see all variety of patients. I see young patients as young as sometimes 7 years old, and my oldest patient is 101 years old. You can have a career where you just see athletes, but I really enjoy the active individual, whether someone's trying to return to a college level Division I team after a hamstring injury, because I do have athletes in that category, or someone just wants to be able to play with their grandchildren, but they're having too much pain in their shoulder or their knee. That's really important to me. It doesn't matter what level of activity you are, like being active is the most important thing that we can do. Quality of life. I enjoy all types of ages, categories of activity level. That's what my day to day looks like. I'll see patients usually around 6 to 8 hours a day. Consult, will diagnose them. I do ultrasound procedures. If they're having pain in a joint or muscle or tendon or something is going on, we diagnose it and then we find the best course of action. Sometimes that involves me performing ultrasound guided injections in the office. I often do them the same visit as the consultation, especially because people are in a lot of pain and want to have some relief when they leave the office. We always want to make sure that it's the right thing to do. Sometimes they come in with an injury or a fall or a sports related injury that we need to make sure it's not a surgical injury, especially for knees and shoulders. If you have a traumatic injury, we'll order appropriate imaging, guide them on the therapy rehabilitation process. I talk a lot to athletes about injury prevention. We look at kind of their biomechanical status in the office with just hip strength, knee, the alignment, the flat foot, just try to see where we can improve their mechanics and try to also avoid future injuries as well as rehabilitate them from their current injury or pain that they're experiencing.
You talk about injury prevention. How is different your work from the one of a physiotherapist, for example?
I think the prime difference is we have a lot of overlap with treatment plans. A physiotherapist is an expert in the rehabilitation process. We can identify the pain is coming from this condition. These are the type of things that you need to improve. A physiotherapist will definitely create a very detailed athlete specific protocol for the rehabilitation. They do manual work. I diagnose conditions and I can see what's safe to continue sports participation, where we have to hold somebody back and not allow them to progress. If I see someone with a suspected bone stress injury, we're going to take a look at that from even an endocrine standpoint. I'll do metabolic workups to see if they have vitamin deficiencies, metabolic deficiencies, relative energy deficiency status, and we can do some blood work and history taking for that. I think the primary difference is that we work together as a team, but it's a multidisciplinary approach. I'm on the end where we're trying to identify the problem, diagnose the problem, see what needs to improve, what restrictions need to be going in place. And usually I'll send the athlete or patient to a physical therapist for a very one-on-one program and guidance for the rehabilitation process with very strict parameters of what they can and cannot do with the exercises.
Which problems you see more often in athletes, and which is the major issue in professional sport today?
Probably the most common issue that I see is in running athletes and anterior knee pain. That's very common. I think cross country, I have a few cross country athletes or sprinting athletes. A lot of times there's a lot of muscle imbalances. What I always tell patients is runners love running. Many athletes come to me, they've been running for years and years, but their strength training is not up to date. Their mobility is not great. A lot of that biomechanically catches up to athletes. Anterior knee pain or patellofemoral syndrome, also known as runner's knee or jumper's knee, is common. I see a lot of athletes with hip weakness or hip muscle imbalances, glute strength issues. It's really difficult to sometimes get buy-in for some of the importance of these things, but I try my best to explain everyone and show everyone from a biomechanical standpoint, hey, this is what's going on. This is what your knee's doing when you're running. We try to work on improving their pain with correcting their running form. There's a few physical therapists that are excellent in our area. We have a great medical resources in Baltimore, which I'm very thankful for, but they do running assessments where they actually put sensors on different points of the body. We can see what force they're doing on which leg, what happens when there's cadence and speed changes. We look at really muscle imbalances on single leg exercises and force and look for differences in that. We look for the pelvic drop levels with their different exercises and maneuvers, especially with the actual running on the treadmills. We can see in real time. And then they communicate with me pretty directly, the physical therapist, about the results. We emphasize the treatment plan from me, the doctor, and the doctor side and the physical therapy side. So we're all on the same page to try to help the athlete continue and be successful and perform very well within their sport.
Professional sports has evolved a lot in the last 10, 20 years. With all the technology we have today, the injuries going down, but they're actually going up. What do you think about that? Is because we have more diagnosing? What do you think? What's your opinion?
I think there's a few things that likely account for increased injuries over time. One thing is that if we're looking at athletes in the Olympics and professional sports teams, everyone's getting faster, stronger, pushing themselves more. In the sport that I love the most, I love all sports, but the soccer or football, there's so many games. Like teams are playing in the Champions League and their regular league game. It's a lot of pushing, and not enough rest. Yes, we have protocols where they have a special diet and nutrition, but we still need time for muscle recovery. There's a lot to do with intensity, and really performance has been increasing. The fastest times for 100 meters, these short distance, long distance running, marathons, the records are continuing to be broken. That happens from people pushing themselves and training more. Of course, we're reaching those milestones because we have all these other resources, but it also puts a lot of pressure on injury. The main thing is really we're having increased physical demands over time. There's less recovery. There's a lot of sports specialization too early on for kids, parents, everyone's excited going to college, getting scholarships. There's a lot of pushing that's leading to a lot of overuse injuries and overtraining injuries. I think the important part is really emphasizing rest. When I see patients in the office, I always tell them, I played soccer growing up. I still play it now. It's so important. You never want to have an injury or show it. That's how I felt when I was a teenager, because I didn't want to be taken off the squad or first starting lineup because I'm worried, oh no, if I tell them I'm hurt, I'm going to lose my position. There's so much of that encouragement, which is negative encouragement, which is one of the reasons I went into sports medicine. And I do see athletes taking rest days now will allow you to be able to continue to participate in sports for so much longer than if you push yourself and burn out. Like some of the athletes that we see in the professional level, they have such short careers. It's the same reason why Ronaldo, Messi, as they're aging, they have been playing professional sports at such a high level for so long. It's so important because resting, recovery days, if they're not feeling right, that you should take a break when you need to and push yourself when you need to. And you have to be really in tune with your body. I think that's probably the main reason why we're having increasing injuries, just that drive for more and more performance. We see it in concussions as well. I think with concussions, we have so much more knowledge about them existing, so much data and things of treatment have changed. Before, we might have seen someone years ago and they have a headache after head injury and there's no real diagnosis. There's no specialist to see for concussion. We're unaware of the number of concussions, but there were so many concussions in the past, just like there are now. I think we just have a lot more knowledge and data about how to treat it, how to recognize it properly. And that has a lot to do with certain types of injuries that we're seeing more of as well.
There is a lot of evidence of supporting a return to competition with targeted sport nutrition strategies. In your experience, is there anything else athletes tend to underestimate when they get injured?
I think athletes underestimate a few different things. So nutrition, like you said, is one of them. I try to make sure that, especially when we have higher level athletes, that they have seen a sports nutritionist. We have a few in the area that I can send them to, because fuel for your body is the most important thing. It allows for energy, consumption, recovery, performance. So every time I do tell athletes, there's always, do I have to see them? What is your diet like? They don't have a plan, especially in the high school ages. They're just eating, but eating without a plan to actually fuel their body. I'm most worried about patients that have stress injuries or repetitive stress injuries, where they've had a bone stress injury in their shin and then in their foot. Something is going on, either overuse or a metabolic disturbance. And often it comes down to not fueling their body enough for the level of activity that they need. I think athletes can end up underestimating the importance of mobility and rest days. That is the most important thing. I see people, they're running 7 days a week, training for their cross country, they're training for their sprint trials every day. They're running long distances, but doing 70 miles a week plus sometimes. Then they'll get a bone stress injury. Now they cannot run for 2 to 3 months because they have to recover, heal, build their strength back up again. I think they underestimate performance doesn't always equal more training. It's also being smart about the rest days, the body, your cross training. That's probably the number one thing that I've seen with athletes is just underestimating the importance of allowing your body to rest and recover some days and how it can really lead to better performance long term. I think that's really important. Mobility and stretching, that too. We're always strength training, but the myofascial tension, scar tissue, the idea that building muscle is muscle injury and building up and recovery. That's the premises of strength training and hypertrophy with exercises. If athletes aren't really working on mobility, a tight muscle can't function normally and it compensates. That's really important where it may be more fun or feel like you're doing more when you're just strength training and building strength around certain areas. But the mobility aspect of things is so important for the whole range of motion of the joint in order to be successful, to improve power and really performance, essentially.
I have worked with many top tier athletes over the year. I haven't seen this in elite level, but often professional athletes, when they're not that level yet, they often tell me, if I don't train, I feel guilty.
I understand that as well. It's the same reason even when I work out sometimes, I said, oh, if I'm not sweating or burning, I feel like I'm not exercising enough. That's the athlete part of my brain. The medical side, you have to understand that high heart rate, sweating, feeling like you're pushing yourself isn't always the right exercise. I try my best to emphasize to them about the long picture, the bigger picture. That's the most important thing. The best thing that you can do for your body is give it appropriate rest. We're in a constant balance between breakdown and buildup. That's for our muscles, our bones. We have osteoclastic plastic activity for bone stress injuries. If we don't allow our body to rest, heal, and recover, we're only going to lead to harm, overuse injuries, and being taken out of a sport for a period of time much earlier or longer than we would need to if we just really listen for that. I do spend a lot of time talking to athletes and really explaining and encouraging why it's so important to listen to your body's needs. It will tell you, and if we ignore it, that's when we usually end up going to the side where we need to see me in the office for something more than a diagnosis, treatment, and rehabilitation, those type of things.
You talk a lot about injuries. What a professional athlete can do instead for prevention?
I think for professional athletes, there's a lot of different ways to prevent injuries. It's very specific to the person. It depends what type of sport they're playing as well. It depends on, are they playing multiple sports throughout the seasons? The most important thing, I think, is you are an expert in nutrition, but really knowing what fuel your body needs. What you need is different than what I need for sports performance. That's everyone. It looks at your metabolism, your diet, your composition, a lot of factors. I think identifying your nutritional needs as an athlete is very, very important. I think appropriately strengthening the muscles that you need to perform in your sport is very important. If an athlete is an explosive athlete, like they're sprinting or doing an explosive movements, a sudden shifts and turning, they need to have really good neuromuscular control. Someone that does not do as explosive motions or cutting, pivoting, and rapid movements and changes in direction, they still need neuromuscular control, but it's very different depending on the sport that you play. Identifying those type of things like in a full physical assessment of what we need to work on, and then exercising and practicing those things. The best things for neuromuscular control is repetition and movement and sudden. There's different types of training, and you can have unexpected loads, these type of things. You want to try to tailor your goals to what sport you're specifically playing. One of the most important things that I've seen in athletes is really weakness of the core. A lot of people, baseball players specifically, really a throwing motion, batting motion. The throwing motion, it starts from the pelvis, the lower legs, and it translates up. Explaining to an athlete, well, if you don't have excellent core strength and you're pitching hundreds of pitches, you're going to increase shoulder injury because the muscles that are supposed to help are not able to move normally. There's a lot of compensation. Really identifying the whole kinetic chain for your specific sport is very, very important.
You mentioned baseball, one of the sports with most injuries of all.
See a lot of baseball injuries, and most of them are overuse from biomechanical issues that they've had for a period of time. One thing that we have, the glenohumeral internal rotation deficit, tight shoulder capsule, where we're building for a faster throw or pitch, gaining external rotation. The athletes, they'll lose internal rotation, then you lose the force. The force stops and the shoulder takes a lot of pressure and force, leading to injuries. Mobility of the shoulder. The amount of athletes that I've seen that are high school and early college that haven't seen exercises like the sleeper stretch for capsular stretching, it's shocking to me sometimes, because these are so many things that if we can educate at an earlier level, can reduce the need for some of these treatments that we have because of injuries. A lot of baseball athletes that really haven't been explained maybe the importance of core. They often think of core as just my abdominal wall muscles, but it's 360 degrees, your hips, your glutes, the rotation, your mobility, it's all of that stuff together, and how you're going to have good form for the activities that you're doing. A force goes somewhere, and force, actually, if not addressed properly, will go and cause problems in the elbow, in the shoulder, and these type of areas.
I have a good friend of mine who is a famous strength and conditioning coach. He wrote one of the first articles about the core disrep effect. His article, he said, show me a sport that does not involve rotation, and I'll show you a sport that does not exist.
Core is the most important thing, even from non-athletes, people that are just being active. We're sitting at our desks all day. We're still supposed to use our core to stabilize our spine, our low back. A lot of pain stems from core weakness. Unfortunately, it really can impact people's lives detrimentally, because core strength is one of the most important things we can do. It affects your ability to lift and carry just on day to day. In athletes, your core stabilizes all of your joints. We have local and global stabilizers. Local, we're seeing it, or on a joint, you have stabilizers, but the kinetic chain, we move through these motions. We may not be thinking, when I'm running, I need to keep my core engaged, but it's doing it. If you don't have the motor control, the strength, you're going to have abnormal mechanics, have higher risk of injury if you're unable to control your spine and your pivoting and sudden motions with strength deficit. It's so important.
We see a lot of back chain injuries in sports. How come?
I see athletes that are younger too with spondylolysis or stress defects in their spine at younger and younger ages. The youngest person I've probably seen with this issue is 11 years old. They're actually playing soccer a lot, running injuries, high stress, and that happens from biomechanical issues. Just like you can get a stress injury in your shin, if you don't have the core strength and pelvic and hip and low back stability, or you're doing too much overuse, not having appropriate rest days, you will get issues in the posterior chain. It's one of the weakest parts of the body. Most people are heavily quad dominant. Pretty much everybody really is quad dominant, but it's just about the ratios. I think for hamstring to quad ratio 3-2 is the best. Anything lower than that puts you at risk for overstraining, quad tendonitis, hamstring injuries. The posterior chain is often neglected. Just today in the office, I saw a few people with neck pain. The traps are on the computer, always leaning forward, but having good posture. If I sat like this all day and I don't have good strength in my posterior chain, it's going to actually hurt. I'm going to feel pain in those areas, because what we're asking the muscle to do, it's not strong enough to do. Targeted strength training in the posterior chain is very important. I think some of the physical therapists and personal trainers refer to it as a double cross sign, where you have tightness in the upper traps, the weakness in the lower back, the shoulder pain. It's just one of the most common issues that just on the average person, let alone when we get to a higher level of a sport and activity, it's just so important to have very well balanced posterior chain and catch it up so we don't overload these areas for injury.
But when I did my dietetic internship, I couldn't train for 8 months. It was impossible. I started to have pain everywhere, lower back, knee. It's been the longest I've been without training in my life. I've always been extremely active. But that particular period in my life, it was impossible. Then I started to go back to train, and they started to disappear.
It's so important. That's when you were doing were you on like a clinical rotations for a while? It's so hard. 'Cause honestly, that's the number one conversation I have with people. There's not enough time in the day sometimes. When your career is fitness and training and athlete, but very few people have that, where It's just that. So people have to go to work or take care of family members or children and these type of things. Then they have to also strength train your muscle groups 2 to 3 times a week, and cardiovascular exercise, ideally 150 minutes of
Yeah.
moderate and 75 of vigorous. If you write down everything you're supposed to do, it's overwhelming. But I just tell people, try your best. Compound exercises where you're working more than one muscle group, even if you can get 10 minutes at a time in for something small. If you have a little break in your evening or morning, it's better than nothing. It's so important to keep moving because inactivity, it's dangerous. I read something where it said that physical inactivity is the fourth leading cause of mortality in the US. So that's what
Yep.
they're saying. It's completely true because just movement is medicine. You feel better, your joints feel better. I do have people where it hurts to exercise, and that's a problem. That's why we need to know, why does it hurt so much that you can't do the exercise, and how can we improve your pain so you can get stronger? Because it's that kind of that infinite loop. You have pain, then you get weaker, then you have more weakness and instability, then you have more pain. It's just, we need to break that pain loop cycle. That's something that I really enjoy about my job, is I really want to get people active and completely understand. I've torn my MCL, injured myself. It's very depressing when you're an active person, an athlete. Your identity is your sport sometimes, and you don't know what you're going to do even off of sports for a few weeks. With concussions especially, all of a sudden you go from it's everything you do to you can't do what you love. And I think it's just such an important part of my job, is to try to help people with that pain loop cycle and explain that sometimes we're going to have a little bit of discomfort, never a lot when we're doing the strength training. Then that's probably too much, or we have to change something. The goal is to really have some discomfort, soreness, muscle related building pain, to not have pain in that joint or stability or with a specific movement. It's definitely challenging, and sometimes we need to pivot and change, look at the back when the hip is hurting, look at the hip when the back is hurting, to see how they're relating to each other and referral pain patterns, that type of things. It's not always so simple.
I think one of the most dangerous is combat sport, especially when cutting is not done properly or professionally. Fight with a concussion and they're dehydrated. That's very bad. Before, there was not so much control as today. The return to fight was a very, very short time.
Definitely. I've actually seen a few combat athletes too in my practice. And it's tough because some of them, they do that. That's their job. They're semi-professional athletes. They make money from this. And one concussion, sometimes people are out for a significant period of time. And it's very frightening for someone to go back in, because from their perspective, is now that I have a concussion, is every time I get hit, will I have a concussion? The answer is no, it doesn't happen every time, but the risk increases slightly after having a single concussion. I think the most important thing to reduce concussion risk a second time is making sure that you're fully recovered by the time you go back into the sport. We have different parameters and guidelines that we use. We really want athletes to return to higher cardiovascular exercise without symptoms, symptom free for at least 24 hours, and then able to cognitive load without headaches and eye strain. We want, it's just a lot of parameters that we use, and make sure that they can really push themselves in a safe environment. Because sometimes you'll see your day-to-day healing, but when you return to higher levels of movements, like for gymnastics, when people are twisting and turning, you might get dizzy. That's a slight lingering effect. We always look for that in the return to play. When you do your sport-specific training, are you still having any lingering symptoms? That's one of the other things we were talking about. It's like, athletes don't want to be out of sports. I completely understand it. If I really emphasize that we're going to start your return to play, we usually have someone increase their cardiovascular exercise. Then you do like a sport specific drills, non-contact practice type of thing, a full contact practice, and then return to sport. If they have a symptom of the concussion show up when they're pushing themselves, increasing their cognitive and physical loading, I tell them, please make sure you let me know. If it's 1 or 2 extra days before you go back to sport, it's so much better than having another concussion on top of a concussion that hasn't recovered. Education is one of the most important things with athletes. Is you can say, don't play sports. If you don't tell someone the why, it just seems like you're just trying to hold somebody back from something. I always try my best to really explain to them, why is it better to take this little break now and think about the future and the long-term kind of implications of a small decision now? And me being much older than a high school athlete, still doing something that I love. Obviously, not as high competition as I used to do before, but our body moves for a very long period of time, and brain health and physical health, when treated properly, can keep us going well into your 80s and 90s. I've seen that for a lot of my patients, which is great.
Which is the interaction between a sport medicine doctor like you, a physiotherapist, a strength and conditioning coach? How that communication happen?
I think the most important thing is that we're always able to communicate with each other, because a lot of times these issues and injuries, it's complicated. There's a psychosocial aspect of it, there's an injury aspect of it. It's important that we're all on the same page as well, so we can reassure patients together. I might see someone with a hamstring strain day one, I diagnose it. I don't think they need an MRI. If they don't have a suspected tendon rupture, we do the rehabilitation. I might see them a month later, but they are living 30 days with a hamstring injury. The physical therapist gets to see the patient 2 to 3 times a week. It's like an extra set of eyes. Whether or not, if they ever have any concerns or different areas bothering them, like, they have my cell phone, they have my email, they've been instructed to call or text me anytime. If they have any concerns, we'll find a time that we talk on the phone and see if I need to bring the athlete back, if we need to change a plan. For strength and conditioning coaches, the same type of thing happens. Usually I'll give a written prescription of what I would like in general to improve, whether it's hip and glute strength. They're obviously the experts in the actual training part and plan specific to the athlete. The most important thing is multidisciplinary, that I'm available to them and they're available to me. And then we work together to really reassure athletes, because pain is the worst thing anyone can go through, whether it's physical, emotional, doesn't matter. Just the fear, even after a single injury, the risk of re-injury and the fear of re-injury. A lot of times, if myself and the physical therapist, we're all on the same page, we can help encourage and reassure the athlete together that they're going to get through this. They find it very reassuring that we're talking to each other, not, oh, they said that, I didn't know that. We want to be on the same page always. I talked to 3 different physical therapists today during my daytime. They usually will give me a heads up before I see my athlete, ahead of time too, what their thoughts are, and then I let them know what my thoughts are after our assessment and work together to come up with a long-term plan or even short-term plan for patients.
Many major sports today have a sport medicine doctor and stuff, but many do not. In those cases, when do you think an athlete should see a sport medicine doctor?
One thing is, if someone has never been talked to about the importance of muscle strength or performance, I think there's no harm to see a sports medicine doctor before, because I've actually had some athletes come, I don't want to get injured. What's the best way I can do? This is the sport I play. What do you think I should do? No one's talked to them about strength training and this, or they're a high school athlete and they don't have a strength program at their school. I don't think there's any harm to see someone ahead of time. We usually do pre-participation physicals for athletes in the US, and we have to clear them medically. Primary care does it, sports medicine physicians can do it as well. Sometimes they'll have the doctors go to a school, but you can definitely ask at any time you have a concern or you're worried about it. I think there's no harm to meet with someone and just get our thoughts specifically. But for pain, I think anytime you are doing something and experience sharp pain, it's probably something that needs to be looked into. The pain that affects your movement pattern. I always ask parents of young athletes, when you see them running on the field, do they look like they're running normally to you? Or I have obviously asked the athlete too, but it matters what people are seeing, because sometimes with adrenaline, you don't think you're moving abnormally or running with a limp or anything like that, but really you are. And for me, that's a big, big red flag. If you see that an athlete or you feel that you're not able to move normally and there's compensation, the problem can get worse or turn into something much, much worse, in pain in other areas, or a worse type of injury where you cannot protect your joint or your motor control. My least favorite saying ever, it's the least, no pain, no gain. Oh my goodness. People will come to me and say that, oh, no pain, no gain. I push through the pain. Well, the problem is we might be able to push through the pain, but your muscles don't push through the pain, so they'll compensate. We end up getting other types of problems and injuries. The most common probably I'll see is if someone's knee or back is hurting, they start getting very bad gluteal tendonitis because the glutes are working hard to try to stabilize a knee that's not working normally or moving normally, or their back is hurting a lot, so they're compensating a lot, and again, puts a lot of pressure on the hip, core, pelvic, and glute muscles. I think very important, if you're having abnormal movement patterns, sharp pains, or pain that's happening every time you're doing something, you probably should have it looked into, even if it's a mild level of pain, because there's no harm to at least see us. I'm not going to hold anyone out of a sport unless I absolutely think it's necessary. I think a lot of athletes are worried about that too. If I go see the doctor, they're going to tell me I can't play. There's a select few conditions that if I suspect it, I will do that. But the majority is we look at the red flags and the yellow flags. How can we keep you playing? What modifications could we make before to try to prevent the problem from getting worse? I really only try to hold someone out if I absolutely think there's a stress fracture that could be going on or some detrimental problem with abnormal movement patterns that they just need to take rest, But otherwise, it's very safe to come see us in the office because we're just trying to prevent a bigger problem from happening.
What do you like the most about your job?
I like a lot of things about my job. I think my favorite part is just seeing people motivated to exercise and be active and returning to do what they love. I've been there too. Growing up, sports was my favorite thing. You learn so many things like team building, relationships, discipline. There's so much that you learn. It's just so great. I really love helping people feel better because, as I was mentioning earlier, pain is it's such a terrible thing to go through. When something hurts, sometimes you can't even take pressure off it and it's bothering you all the time. For someone to recover from an injury and go back to something that they're so passionate about, it makes me so happy to see them be successful with that and see where their careers take them. I also get very happy when I see just a grandma being able to carry their grandchild. It's such a small thing, but it's so important. Like when you lose the ability to do these very simple things, I can't even imagine. I haven't had this problem yet. Hopefully not ever, not for a long time, but it's just loss of control of things that you want to do. So trying to help people regain control in the activities they enjoy. It's really my favorite part of the job. Sometimes we're not successful as I'm non-surgical. Sometimes people need surgery. At least we can get them to a solution of the problem and get them there, even if it might not be easy. I ask people to follow up with me and just let me know how they're doing afterwards. Every success story makes me happy, motivates me to keep doing what I'm doing and trying my best because that's all we can do.
Many people have a call for the profession, but some people do not. Did you have a call, or sport medicine is something that you develop interest while in medical school later in life?
I love sports. I love medicine. I love the human body, endocrine systems, and just how everything can come together. It was an idea that I came up with a little bit later on in life, in my early 20s, but it was mostly because I didn't identify it as a career option for me. Growing up, I had injuries, but I don't think I ever was taken to the doctor to manage them. I didn't have really that type of professional like role model of sports medicine to look up to. As I grew up and realized like injury prevention, sports medicine, this is amazing. It was really a calling. I love it. When I realized that, what, I can do that. That's exactly what I did. I'm from Canada. I had to do some visa requirement stuff too before I did the fellowship. One of the reasons I didn't go immediately into that too, I had to do some other things to sort out, but it all worked out. And it was the hardest year of my life, but also the best decision I ever made. I remember going into fellowship because internal medicine, it's very different than orthopedics and sports medicine. There's a lot of overlap from the primary care side, like management of athlete blood pressure and conditions, identification of medical issues. Orthopedics is also very complex. There's so many moving parts. So it was a lot of studying and a lot of learning. I was afraid of that before I started. I remember people used to ask me in the beginning of my fellowship, I'd see family and friends, "Are you so glad you did this?" I said, "Ask me in 6 months." That's what I used to tell them. I didn't say, "Oh my gosh, this is stressful." I would tell them to ask me in 6 months. I guarantee you at that time, I'm going to be really happy because that's when I'll feel more confident in my knowledge. As a doctor, it's part of our identity is also knowledge and studying when we feel like we don't know enough, which I feel like that we're learning every single day. Specifically when I felt like, wow, I have a lot to learn in this subject. You don't feel good. You do the work, follow your passion, you study, you learn, you try your best for the patient. The most important thing is when you don't know something, ask for help or ask for a second opinion. I am never going to be beyond that or above that. I asked one of my colleagues to see a patient for a second opinion today just to make sure because not everybody knows everything and we all have different training experiences and exposures to different athlete populations and patients. Someone else might have seen or learned something that I have not learned and seen yet. I think if we put the primary focus as the most important thing is helping our athlete and patient recover and get better beyond any ego, anything like that, that's the most important thing for us. That's why I like my job, because I have a great team at my hospital. Everyone's really helpful. I have colleagues that I still keep in touch with around the United States, sports medicine doctors, and everyone is very open to sharing their opinions if you want to run a case by them or get their thoughts about it. I've never had any problems. I love the sports medicine community. Everyone is so just kind, helpful, and everyone's trying to help each other become successful and follow the passions. Just like you, when I was telling you about soccer, you shared me information about something I didn't know with the Football Institute and different experiences. We're just trying to help each other grow into the careers that we want for each other and ourselves. It's great.
Where do you see yourself in 5 years, professionally speaking?
The dream, which is, I don't know if that's possible. Liverpool, realistically, I think I really love what I do now, but I would like to have some more team involvement. In the US, we do have teams get contracted with hospitals. If your hospital doesn't have a contract with teams, you can't really work with them directly. It has to be under the hospital organization, at least where the area that I am. So I try to spend a lot of my time volunteering and seeing where I can help the community and local sports organizations. It would be really great to have more involvement in soccer, USA soccer, or internationally, and just be involved with that, because it's a passion that I have of mine. And especially going into sports medicine, I play it, I love it. It's just so fun. Hopefully it involves a little more of that.
Soccer is a new sport in this country. There is not yet the culture of soccer. In my country, in Italy, you learn how to play soccer before you walk. Everybody plays soccer. Every kid. There is no kid that doesn't play soccer. Like Brazil or South America in general, same thing. America is changing. Then there is the World Cup. A lot of doors will open to work in a team. That's not my goal. I don't want to work in a team personally.
So that's a challenging part too. Sometimes working for big sports organizations, it seems such an amazing, cool job, but the amount of pressure that it does put on your lifestyle, family life, those type of things, it's very challenging because you have to travel with a team, be willing to, at the last minute notice, it's very long and difficult hours. The job seems so glamorous and amazing, and it's cool. I worked with, when I was in my fellowship, we did work with the NHL and the Philadelphia Flyers. It's really neat, but you see some of the doctors, they don't get to go home to their families till midnight when they have a soccer game after working long hours during the day. And there's few games a week. For me, I think lifestyle and balance is very, very important. My main goal is to have good balance, also relaxation and lower stress levels too. If I did the same job I have now for the rest of my life, I would probably be perfectly happy because I love it. I see different types of people, different types of activity levels. I love like the organization that I work. Everyone's very supportive. I love the people I work with. And definitely having some volunteering. I had applied for a USA a soccer organization. Hopefully I'll get accepted because at least the commitments are a little bit different. Hopefully over time can become more open to me and we can see how it goes. Everything is not as great as it seems working with professional sports. It's high liability, high stakes. There's a lot of stress involved with that too. Someone has to really love something to enjoy doing that for a long period of time.
That's why it was never a goal of mine, because you work 7 days a week. You don't know when you finish.
When are you supposed to strength train, right? Your own self. That's the problem.
If you do something wrong, it's on you.
Yeah.
It costs $1 million. A lot of pressure. For
Yes.
example, recently in tennis, Sinner had a heat stroke in Australia. I think that's a dietitian fault, because that's the person that handle the hydration, and you need to know when you're under heat, what's happened, and what you have to do.
So that was so interesting that happened. I've actually never heard of that before happening to a professional athlete in this setting, at least. I see it a lot when we cover marathons, but that's kind of the average local athlete or traveling with nutritional status, hydration, understanding the signs and feelings that you're having in a body to recognize that. It's definitely high liability, high stakes, high stress. That's for sure.
I love working one-on-one. I can establish a relationship. That's what I love. This is a question I like to always ask. If you could have a dinner with 3 people, live or not alive, who would they be and why?
I'd probably have dinner with, number one of my teachers from fellowship, Dr. Bartolozzi. I think he was wonderful, like the most encouraging teacher that I've ever had in my entire life through school, residency. Just he uplifts you, even when you think you don't know something, you're not correct about it. He's just always so positive and encouraging you to learn, be curious. And his bedside manner with patients was just amazing. Every person that saw him just highly respected and loved him. And just so we, in our fellowship, we only get to spend 1 year with somebody. It's not that much. And we only have 1 or 2 days a week at that time, too. Just now that I've been in practice for 4 years, there's so many questions that come up, and you'd say, that I can have and just more detailed information. I would joke with my co-fellows. We still have our group chat on our phone. I said, "Don't you guys wish we could do fellowship again?" Everyone said, "No." Well, I wish I could because it's just constant learning. There's nothing like being in a training year because you can absorb so much knowledge. Although we do learn in our own practice, it's just so different going in with that more knowledge into the training. It would be great to talk to him and get his insight about some practice, life experiences, ask more detailed questions that I was probably incapable of asking before because I didn't know about my questions. He's probably one person I'd probably want to all have dinner with my grandmother. She's still alive, a questionable age of either 99 or 96 because something to do with her birth certificate. I don't exactly know. I think she's 99, but she does have advanced dementia. So she started getting when I was in my early to late teenager years. Same thing. You don't know what questions are important until you grow up and become more mature, think of new ideas and things in adulthood, things you wouldn't think of beforehand. I would love to talk to her, just let her know how I'm doing and just life questions. A third person, Liverpool team doctor, because I want to see, because or any professional really team doctor, but specifically because I love Liverpool so much, you'll never walk alone. I think talking to someone who's doing that career that seems so glamorous on paper, just saying, how is your lifestyle? How are your day to day? Just really talking to them about the ins and outs of that type of position, if that's something that they're enjoying and if that's the lifestyle that I would want. I'm not sure it is the lifestyle I'd want, but talking to someone in that field and really being able to sit down with them and say, what is it like would be very, very nice to know exactly because I don't know any professional team doctors yet personally. It'd be nice to at least learn about how it is for them. I can either cross that off my list as a team doctor scenario or understand if that's something that I'm really passionate about to pursue as my career goes on.
Dr. Toor, thank you so much for coming to the show. It's been a very great conversation and it's been a pleasure having you.